In these stressful times, when we are asked to do more and constantly being under pressure, you may find yourself experiencing signs and symptoms of hypertension. Signs and symptoms may include severe headache, nausea and vomiting, visual disturbances, neurological disturbances, disorientation, and decreased level of consciousness that include drowsiness, stupor, or coma. Lifestyle changes alone are sometimes ineffective. Your hypertension may require antihypertensive medications in conjunction with lifestyle changes. Antihypertensives are used to treat hypertension, which is a chronic disorder that affects 50 to 60 million adults in the U.S. Untreated hypertension can increase the risk for myocardial infarction or heart attack, heart failure, cerebral infarction and hemorrhage, and renal disease. Here's where Losartan can help. Losartan is just one of the drugs included in the class of drugs that are angiotensin II receptor blockers, or ARBs for short. Losartan is usually taken one time per day in the form of a tablet. Abraham 2015 stated that ARBs are advocated for people with stage 1 or 2 hypertension and people with type 1 or 2 diabetes. This article also stated that ARBs are effective in initial antihypertensive therapies that lower blood pressure. According to DESI 2016, ARBs have shown the ability to reduce the risk of stroke and heart failure, as well as major cardiovascular events in randomized trials. ARBs can be used alone or with other agents in the management of hypertension. Contraindications for the use of Losartan include a known allergy to the medication or class of medication, severe liver impairment, or pregnancy. ARBs can cause severe injury or death to the fetus if taken while pregnant. Discontinue Losartan if you become pregnant, and do not use Losartan if you are breastfeeding. Drugs that interact with Losartan include NSAIDs such as Tylenol and COX-2 inhibitors such as aspirin, which can blunt the antihypertensive effects of the medication. Other antihypertensives and diuretics may increase the antihypertensive effects, which can lead to hypotension. Take Losartan as directed, and do not discontinue without consulting your healthcare provider. Take missed doses as you remember, and ensure not to take a double dose. Take Losartan at the same time each day, and avoid using salt substitutes that contain potassium. Avoid sudden changes in position, and rise slowly to avoid orthostatic hypotension. Avoid alcohol and standing for long periods of time. Avoid driving and activities that require alertness until the response to medication is known. Notify your healthcare provider of all prescription and over-the-counter medications, as well as any vitamin and herbal supplements taken. Consult your healthcare provider prior to starting any new medications. Notify your healthcare provider immediately if swelling of the face, eyes, lips, or tongue, or difficulty breathing or swallowing occurs. Ensure you are taking your blood pressure at least once weekly, and report any significant changes to your healthcare provider. Attend all follow-up exams to evaluate the effectiveness of the medication. The most common side effects are dizziness and hypotension, or low blood pressure. Other side effects include anxiety, depression, fatigue, headache, insomnia, weakness, chest pain, swelling, tachycardia, skin rashes, nasal congestion, abdominal pain, diarrhea, nausea, vomiting, drug-induced hepatitis, back and muscle pain, and angioedema, which can be life-threatening.